One other thing I wanted to mention was our program today is done in partnership with Mills Peninsula. And where's Dr. Klonoff? There he is in the back, waving his hand. So he is clinical faculty in the Adult Diabetes Center here at UCSF and has been a very close partner and supporter of all the work we've been doing, and we appreciate that. And he also has his own unique research program that I encourage you to speak with him about. So our next speaker, we're going to change gears, and I want to bring up Meg Okumura. She is an assistant professor in both pediatrics and internal medicine, and you'll see why that's a very important part of the job that she does now with us. She received her training at Yale. She went on to do a Robert Wood Johnson Clinical Scholars Fellowship at the University of Michigan, and Health Policy Fellowship at the Philip Lee Institute at UCSF. And she's currently funded by the Agency for Healthcare Research and Quality to study ways to improve healthcare delivery for patients with childhood onset chronic diseases. So this idea of transition from childhood to adult care, I think, is one that we all have a very important stake in. And she's really trying to study this and develop ways to optimize it. So she's currently partnering with both me and Dr. V at UCSF to generate a young adults program with appropriate support measures in place. And she continues to see patients in her own practice in both internal medicine and pediatrics. And in fact, my family had the pleasure of her treating my wife for a broken leg the other day, and she had to take me aside and tell me what my new responsibilities at home would be while she was recovering. So thank you. Thank you.
Thanks so much. It's such a great honor to speak, and most of my research has been focused on trying to improve care delivery for your kids and your family. And so this is really where the rubber meets the road. It's quite an honor. It's much more nerve-wracking for me to present to you guys than it is to the research community. So just for disclosures, I have no financial disclosures to disclose. I am board certified in both pediatrics and internal medicine, so if I feel a little schizoid because I'll take my pediatric hat and my internal medicine hat, bear with me. My research specializes in the transition of children with chronic diseases to adult-focused care. And I'm not a diabetologist or a lawyer, and that becomes important because for the day-to-day management stuff, you'll do that with your diabetologist. And I'm going to talk about a lot of legal issues. Luckily, Charlotte's in the audience from the Disability Rights and Education Defense Fund, so she'll keep me honest about the legal stuff. Today's talk is going to be targeted toward your kids, and you as parents get to take a back seat a little bit. But I'm going to go over post-secondary education and vocation. It was something that had come up a lot with adolescents and young adults about not being well prepared, and I thought it would be a nice addition to the talks. And then introduction to transitioning to adult-based care, discussing advocating for yourself, and really go ahead and ask questions. So why is planning for the future important? And as you've seen in the previous talks, there's been remarkable advances in medical care, which has brought the average lifespan of those with diabetes near the average population. And though I was really tempted to talk about Medicare and Part D plans, we'll put that off till later today. Your doctors and the clinic staff want to ensure that you are well prepared along your journey to and throughout adulthood, both in diabetes management and in life in general. So, when we think about that change from grade school, middle school, and high school, there's a lot of things that differ when we think about college and work. And unlike in high school, where school is really mandated to know about your health condition, colleges and work do not. And so, when we think about kids and they're going on, it's like, hey, I'm going to be a college student, this is really exciting. Oh yeah, I do have diabetes. College is a time of great fun and learning. There's a lot of time, there's a lot of stressors. It's late nights and studying. I'm sure many of you can recall pulling all-nighters. Sometimes you a lot of long waits for events. It could be for signing up for classes, waiting to your class when you're on the wait list, for instance. And then you have to kind of think about, well, what happens when I get sick? Do I have side effects from my medications? Lows, for instance. So knowing your rights. Throughout this talk, it doesn't mean that you'll ever have to use any of the things I talk about, but it's the knowledge and the empowerment that you can have by knowing what your rights are. And it is crucial that students and their advocates become knowledgeable about their rights and responsibilities in post-secondary education. Because, although protections exist, the student has considerably more responsibility to request and design their own accommodations. And this responsibility is ongoing for the rest of your life. For many students with diabetes, good self-advocacy skills will be key to success, and knowing your rights is one of the most essential elements of effective self-advocacy. So when we think about protection for persons with diabetes, our policymakers gave people with healthcare needs rights under kind of a crappy name. It's the American with Disabilities Act. The ADA protects you as a student and as a person with diabetes, and allows you to ensure that you can fully participate in work and school without worry. But when I do my focus group with you, many of them are like, but I'm not disabled. I don't need any kind of protections. And it's true. You are a fully functional person with a very long lifespan ahead of you. It's just that your pancreas needs a little bit of help. So the Act retains the ADA's basic definition of disability as an impairment that is substantially limits one or more major function activities, a record of such as an impairment, or being regarded as such impairment. And this list includes major bodily functions. And I'm always interested in listing these. These are function of the immune system, normal cell growth, the digestive bowel, bladder, neurological, brain, respiratory, circulatory, endocrine, and reproductive function. I'm not sure what's not included in that, but as you can see in highlight, endocrine, this is where type 1 diabetes is covered. Along with the ADA, some of you may have heard of the Section 504 of the Rehabilitation Act. This is an extension of the ADA Act for institutions that get federal funding, because the ADA didn't necessarily cover that. So people have heard about the 504 plans, the ADA. At the end of the day, they're pretty much the same. But how do these laws help me? It affects post-secondary education programs, such as private universities, vocational schools, and schools that receive federal funding. It's similar to grade school and high school and allows for accommodations. And it helps with taking exams, filing for classes, class time, and setting up contingency plans when you get sick. So what do you mean by specific accommodations? What can I actually get out of this if I need it? And what this ensures is you have permissions to check your blood sugar in classrooms and lecture halls, permissions to keep a personal refrigerator for medical supplies in the dorm room. And when I went to college, the university actually would pay for the refrigerator, so you didn't have to. So, you know, that was, but not all universities necessarily do that. Permission to reschedule an exam if you experience a high or low blood glucose level. Breaks between separate sections of long exams to check blood glucose levels. Being excused for diabetes-related absences and the ability to make up work. Permissions to have extra breaks to eat during a clinical or internship. And permissions to schedule classes so that regular meals can be maintained. Now, a lot of schools and work will just do this innately, but these are the rights under the law. What is not covered? Well, we don't, again, in the post-secondary education areas, training of school personnel in diabetes care is not covered. Significantly extra time on exam, as opposed to just extra breaks during exam, are not covered. Exemption from course requirements and retroactive modification. That is, if you never told anyone you had diabetes and had a low and you had a really poor performance on an exam, but you didn't mention it to the professor, they can't rescind that grade. But, and so that comes further because this also applies to the work arena as well. So how do we, I'm sorry?
What is your source of the information for the last two slides? Do you disagree with them?
Sure. These were all from the ADA, ADA websites. So if you actually, so there's also the Commerce Department through the government. I have a lot of the web links afterwards, if you'd like. Okay. This particular one is actually the American Diabetes Association has this particular slide up, if you want to go through this. So getting supports through school, how does this get operationalized? You can work with your school to develop a plan for emergency care. Every school is a little bit different. Some actually have offices of disabilities. And I know a lot of people, why should I go to a disabilities unit? It's not so much about disabilities as much as being able to advocate for your rights in school. You can work with your providers to help your roommates deal with emergencies. And if you go away from school, oftentimes you can establish care with a local provider to work with your diabetes, especially if you're away during emergencies. And again, oftentimes schools have some sort of point person to help you, and you can try to contact your local school or health department. When we think about preparation for school, the ADA also affects the SATs and the ACTs. These are tests that take about 4 hours, and you can make accommodations ahead of time, so you can check your blood sugars and take breaks to the exam, and it doesn't count toward the clock of your examination. And more importantly, there's confidentiality of documentation. All documentation provided both to the SAT and the ACT will be kept completely confidential. It will be used solely to determine eligibility of accommodations and will not be reported as part of your score report. And for youth that I've interviewed, they found this a really nice modality for them because they could check their blood sugars. If they're low, they can stop the clock, take their break, and go on. So they don't have to worry about, during the testing time, that it was impacting their time to take their test. And this is directly from the website from the College Board. And they state that some students with medical conditions require breaks as needed. When a student is in this category, breaks are guaranteed as requested by the student. The student notifies the proctor by raising their hand, and the timing of the test must stop. When the student is ready to continue, the student again notifies the proctor, and then the test will continue as normal. Students may be approved for extended breaks between section or subject, or extra breaks between at the end to test blood sugars or use the restroom. And in most cases, these extended breaks are for twice the amount of standard time. Most patients with diabetes may not necessarily need that. They may just need the extended break. I mentioned the Individuals with Disabilities Education Act. For those who are in the K through 12 arena, this is the IDEA legislation, and this really gives the ability to make contingencies within the secondary school systems. I'm just touching upon this to know that this exists. We have a workshop this afternoon with a parent advocate for support for families, for those who are not really thinking necessarily about college, but really about kindergarten, preschool, and high school.